Just setting up our Facebook stream. All right, looks like we're live on Facebook. Let me get back to Zoom. All right. Just opened up the virtual room. I'm going to give everyone a minute or so to hop in. I see my two guest panelists. Thank you. And I see about 13 participants. So we'll give it another minute or so, and then we're going to jump right in. It's 11:03. About one more minute. We're going to get started. Hey, Noah, can you hear me?
Yes, I can hear you.
Awesome. Could do a quick sound test. Let's see. Denise, I'm going to unmute you, and we're going to do a quick test. Hey, Denise, good morning.
Hi, Venice. Hi, Jason.
Dennis, I'm sorry.
Okay.
All right. So what I'm going to do for the duration of this is leave both of you unmuted. And that way you don't have to fiddle with the buttons. All right. All right. It is, let's see. There's a few more people popping in. We'll give it one more minute. Start sharp at 11:05. All righty, it's 11:05. I want to thank everyone for joining on time and welcome you to this Monday morning. Right now we have about 20 participants, and that number is likely going to keep rising. So as everyone starts popping in, I will let them into the meeting. So today, I want to first thank the City of New Haven and Adrian Jefferson for allowing us to really come together and have an outlet, have a forum for a discussion, and there'll be many more discussions, but for an initial discussion of COVID-19 and how it's impacted the community, and in our case in particular, the urban professional community, the urban community within Connecticut. So my name is Jason V. Watts. I am the president and founder of the Urban Professionals Network, and we are a marketing, events production, even though that's on halt right now, and media company that started here in New Haven approximately 15 years ago. November 25th will be 15 years. So it is my pleasure to serve the community in a variety of ways. But today, we're going to be serving the community by offering some insight on two specific topics that I feel will help people, that we can have some takeaways from, and we can show a spotlight on two individuals who are doing some amazing things uh, throughout Greater New Haven as well as the state of Connecticut. So with that said, I'm going to first introduce Venice Gardner Moore, my good friend. She's the owner of Embracing Your Difference LLC. She's a clinical therapist and certified life coach, and also the CEO of Embracing Your Difference LLC, a private practice and leadership firm that provides individual and couple counseling, life coaching, postpartum group, mentoring, workshop, and additional training. So that's just a brief intro for herself. And we have another guest today, my good friend, Barishef Adams. He's an acute care nurse practitioner with 11 years of experience in general surgery, trauma, womb care, and hyperbaric treatment. He's also the CEO of Proficient Nurse Practitioners and Green Logic. So as they come on, you'll learn more about what they do and where they're looking to go in their respective fields. So with that said, Venice, Barishef, the first thing we want to do is check in and say thank you, and also say, how are you both doing in this environment? This is something that is extremely new for all of us in our generation. And it's something that I don't think we could have ever anticipated. So just let's start with a general health check, see how things are going. How's the family? And how are you maintaining in this environment? So Venice, ladies first, and then we'll go to Barishef.
Well, thank you. Happy Monday, everyone. Thank you for having me, Jason. I am doing well. I'm hanging in there with my husband and my children, and I haven't left my husband yet. So that's a good thing. But nonetheless, I'm just trying to continue to be still while providing the services that are necessary. There's been a lot of needed mental health services lately. So I am here and I'm ready.
Awesome. That's good to hear. All right, Barishef.
Hi, good morning, and thank you for having me today. It means a lot. Since this has been going on since December, I've still been working at St. Francis Hospital, seeing general surgical patients and trauma patients, and also working in the community, taking care of our patients that have wound care. They still need us. Even though there's that fear and there's scary times, you don't want to get sick. But if you just follow the proper precautions, making sure you have your N95 and your PPE, we do the best we can. When I became a nurse practitioner, I knew I was going to be put in harm's way, but that was my calling. And it's a privilege to take care of people.
Awesome. That's fantastic. So with that said, and first, let me quickly give a shout out to everyone who's on the call. I'm looking at our participants, and I want to say good morning to Adrian, Anika, Anthony, the Arts Council New Haven, Shayad, Colin, Greta, Jay Hayward, Karen Jenkins, Katrina Goins, Kevin McCarthy, Kim Futrell, Lee Cruz, Michelle Clarity, Nat, and Sean Roach. Thank you again for hopping on. So with that said, we're going to get right into it. Venice, if you can share with us some of the things that you've been seeing while you're still working, and some things that you want us as a community to be mindful of in this time with your field and expertise, that would be awesome to start out with.
Sure. Thank you. What I've seen is more anxiety. Unfortunately, there's been increased calls with individuals who are suffering from anxiety, increased depression due to just being confined, one, to their space of home, or just the anxiety from being out in the world and continuously having to work. In addition to that, there's been a lot of worry I've seen in regards to the unknown and the financial aspect as well. Those are, who have been okay financially and just abruptly, are unable to receive the finances that they used to receive. It causes more anxiety and depression in hindsight. And in addition to that, we've done some webinars on couples and families maintaining, because, when you are home and you have children and you are still trying to work and homeschool, it can be a bit much. So just trying to provide some strategies for those overwhelming situations.
Got it. Got it. And with this in your specific realm, what are you advising your clients just from a general care perspective when it comes to mental health? Like, what can they do to avoid the internal pressures and the stress that they may be feeling with everything that's going on?
Well, I offer, firstly, of course, it depends on the situation, because it's case by case. Everybody's situation is different. One thing I do offer, and I've had to practice this myself, is to limit the amount of time that you spend looking at the news and media. It is absolutely important to stay aware and to know what's going on in our community and our world. However, I've seen that, the more you read up on it or the more you look, the more anxious one has become. I've had a few clients who I've actually put on, like, just, specific just homework strategies of, okay, you're only going to look at the news maybe 3 days a week instead of every single day, 4 times a day. Another strategy is to get outside every day if you can. If you live in a neighborhood or an area in which is not as dense, or if you can take a walk every day, if possible, and if you are able, then definitely do so. Of course, making sure that you practice appropriate safe distancing and covering up when necessary. But the sunlight definitely does help with the mental health, and of course vitamin D too. Another thing is, don't be afraid to ask for help and to reach out if needed. Mm-hmm. Because of the increased calls that I've seen, I've also noticed that those people have not really been able to be vulnerable with their loved ones if they are suffering. And this is the time to reach out, because there are additional services out there. And not only reaching out to those in your community, but reaching out to, family members as well, and checking on elderly family members, because that's another worry, is that people are unable to actually get to their loved ones as they normally would if they were ill.
Absolutely. You brought up two things that I think are extremely important, that even myself, you got to go outside. Like, when it's a sunny day, we've been cooped up since March, middle of March, and the weather hasn't been as pretty even throughout those months. But when we get these 65, 70 degree days, you just feel better, even if it's just taking a walk. Yeah. Last weekend, I went to a park in I forgot what part of Connecticut it was. I just kind of was driving. We got lost and kept driving that way north, and we ended up in the forest, like a very beautiful park. Mm-hmm. So things like that, I think, are they're not as they're not as shown in the light as things that help the mental health state. But I think that's a great point. Get outside, get that sunlight, and the vitamin D elements. Mr. Barashef will teach us a little about that, I'm sure, when we get to him, the benefits of that. The other thing, Venice, I want to ask you about is how do you feel social interaction is affecting, or the lack thereof affecting, mental health specifically? Because like you said, we're all in the house. You either, there's a few scenarios. You're either alone, which has its own challenges, from a just mental health standpoint, or you're in the house with a spouse and kids. Mm-hmm. Outside of being alone and being with your family that's in your house, what type of recommendation do you have for some virtual social interaction, maybe sitting outside? Like, how do you feel that will benefit mental health?
Mm-hmm. To be honest with you, I think there's, there's a few things that could be done in this time, and I think that it really does depend on the mindset of the individual. I would definitely offer to utilize this time to take 5 to 7 minutes a day to be still, to be still. Like, we live in a very chaotic world, and a world in which sometimes we look at our cell phones before we even say good morning to our loved ones at times, of course, depending on the mindset, of course, again. But offering that time to be still just sets the tone for the day. It can ground you for the day. Um, Making lists of things that you may have wanted to accomplish prior to this, but were unable to, whether that's taking an online class, or maybe, looking into something else that pertains to your profession, or even utilizing that time to be still to figure out what it is that you want to do for yourself as well, like that self motivation. um, this is the time in which, of course, we are unable to socially connect physically, but there is a lot of opportunities out there to still connect with one another virtually, of course. So
Mhm.
I would say being still, one, definitely writing lists to just, become one with yourself and figure out what it is that you want to do next. And then, of course, utilizing that time to see, other resources that are available virtually to us.
Awesome. Good. One of those resources has been DJ D Nice throwing his
Yeah.
virtual parties. The music is a game changer in this
Yeah.
environment. So, to your point, thank you for that, those tidbits. Thank you for that information. Again, these are just some tips and factoids that we think will help you as the community. And I will allow about 10 minutes at the end of this for questions from our participants. Right now, we're up to 25, so thank you. And if you have any questions, please send them to me, Jason Watts, through the chat, and I would do my best to get those answered before we wrap up. Also, don't be shy. We know it's Monday, but get on video with us if you can and if you feel comfortable. So, with that, let's go into the physical health awareness and the physical health challenges that COVID has presenting. And with that, Bereshef, please, you know, give us really what you've been saying. You're truly on the front lines, and we thank you as well as Venice and everyone else in the state and country providing this service and being at risk. But tell us a day in the life of yourself these past few months, and then after you do that, tell us what you've been seeing in these 2 months.
Okay. And thank you for that. I really appreciate it. And I'm sure a lot of the nurses and the physicians, along with the first responders and the janitors, we all thank you for that acknowledgement. I've been working at St. Francis for over 11 years. Sorry, over 8 years. And this is since December, February, since COVID-19, things have been very different. People are scared. The staff is scared because they have family members. So they worry about if they go from the hospital to their home, are their loved ones going to get it? So, and I completely understand that. Even though some people may say, well, you knew you took an oath to put your life on the line. People didn't take an oath to put their life on the line. They took an oath to do great, to do no harm. And especially they want to get the proper equipment to be able to do their job. And when you don't have that, then it makes you unable. And then it makes it very scary because then now you can get it and give it to your loved ones. So that's kind of, there's that fear. And the other thing that I would like to, point out there, I know it's been over 100 days since we've been in the shelter in place, but I just want to share some facts, so that way we can kind of, shed some light on this, because there are people that are saying they're over this COVID-19, they're over the crisis, and they're ready to go outside. And before I leave today, I need to make sure that and stress the importance to make sure you understand why we should not be over this. So let me tell you where we've been at to where we're at to where we are now. So COVID-19 has been around since December 2019. Um, it's affected so far across the world 4.8 million people worldwide. And then within the US, it's affected 1.4 million. And in the United States, 88,709 deaths already within the US. Now, when you ask how does that relate to Connecticut, when you look at what's going on in Connecticut, if you start with the Fairfield County, and it's interesting when you look at Fairfield, New Haven, and Hartford, and the reason why I said those areas are particularly interested, the number of confirmed cases were higher as you got closer to the New York line, and as you started, going further north, the numbers, the cases, and the deaths started declining. So, for example, Fairfield, you look at the confirmed cases, it was 14,140. You look at the hospitalizations, there were 330 hospitalizations in Fairfield County, and the deaths were 1,125. New Haven had over 10,000 confirmed cases. The hospitalizations were 352. The deaths were 800. In Hartford, you had 8,299 confirmed cases, yet there were 243 hospitalizations, and the death rates were 1,044. As you started moving further north, getting away from the major cities like Litchfield, the cases, the confirmations were 1,234. The deaths were 10. The hospitalizations were 10. The deaths were 116. Middlesex had 898 cases. The hospitalizations were 29. The deaths were 124. New London had 860 cases with hospitalizations at 24 and deaths 65. Tallinn was 636 with hospitalizations at 1. The deaths were 51. Wyndham was 304. Hospitalizations were 5 and the deaths were 12. So when you look at the data on the number of confirmed cases versus the hospitalizations and the deaths, there's a great amount of disproportion of the people that actually went to the hospital. So where are the other people that were dying? They're dying at home, they're dying in the nursing homes. So we can't, get over this. And when you look at the data that the CDC is reporting, they're saying that with a study where they're looking at a patient population from that ranged in March 1st to March 30th, the patients that were affected the most, that had particular comorbidities with hypertension, obesity, chronic lung disease, diabetes, cardiovascular disease. So to sum that up, the more comorbidities a person had, the more likely that they were going to become infected and increase their mortality and morbidity with COVID-19. And there was a misconception. And I think we have to be very careful moving forward, because I think the shelter in place it's going to end by the 20th, and they're going to make a decision, Governor Lamont. And there's that misconception with people that think that this is only affecting the elderly people. I mean, in the data that, the Department of Public Health put up on the website, it shows, yes, that 60 to 80 or greater, they had a higher increase on morbidity and mortality. There were 3,129 people that have died that were in the age of 60 to 80. However, in the range of 40 to 59, there were 182. And in the age of 20 to 39, there were 20. And there were reports of babies dying less than 8 weeks old. So this is not just affecting elderly people, it's affecting young people.
Got it. That's interesting statistics, and one of them hit home. I mean, I think it's important for everyone on the call, no matter what demographic or age group you fall into. It's just better to be safe than sorry. Me personally, last month, 2 months ago, to err on the side of caution, I went to Old Saybrook Stop and Shop. I didn't go to a densely populated Stop and Shop, and I did that out of peace of mind, because there's too much unknown about this. We have stats, we have facts, but there's too much unknown about this. So it's better to be safe than sorry, and it's better to be overcautious than not so much. And it's just it's something that there's still not enough data on. So the statistics are helpful. We have our prayers for the whole state, but in particular, Fairfield County of Connecticut really got hit hard, likely due to the commute and the work schedule and the lives of those who intersect into Greater New York. Another thing, and listen, as far as tips to be better safe than sorry, there's new apps out there like Instacart. I don't know if anyone on the call has used it or heard of it, but Instacart allows anyone at risk who really shouldn't be out there, the elderly, to get their groceries delivered to them at their home. Stop and Shop has Peapod. So for anyone particularly at risk, don't go out for some milk and bread. Have it delivered to you through one of these services, because unfortunately, last month they were closing Whole Foods in Fairfield County. Workers, there's too many risk factors, if you have risk factors, to do things such as go into public places like Walmart or Target. All of those places now deliver on to your doorstep. Other needs can be gotten with Amazon. So let's just be smart and be very cautious and vigilant, and make sure to wear a mask and sanitize, wash your hands after you come home, things like that. Bershep, let's talk about in particular the African American community, because a lot of those risk factors, hypertension, diabetes, all that, right?
Mm-hmm.
A lot of that comes with standard maintenance that I personally believe, and I think we were talking, I think some people are afraid to get their standard maintenance or afraid to venture out because they're, so let's talk about the need to maintain those risk factors that you may already have in lieu of just sheltering in place,
Mm-hmm.
For the foreseeable future.
No, I think that's a great question. And I think, one of the things, in order to make sure that, our fellow brothers and sisters take care of their comorbidities, one of the things I want to shed the light on what Miss Venice Garner says. She says, don't be afraid to ask for help. This is the time that, for the elderly, if they have, because my mom, she's 65, but she's very vibrant, but she can advocate for herself, but I'm going to also advocate for her as well. You have to check in on the elderly. You have to make sure that if you have a mom, dad, grandparents, make sure that they have an adequate supply of their medications. And also tell them if they have their physical checkup coming up, they should go if they can. They should, or a lot of primary doctors are doing the telehealth medicine. They should make sure they should get their appointments if they have the access, like a computer or a laptop, to be able to see their doctor in the home setting. If not, if they can practice safe measures, wearing a mask and getting a ride to go see their doctor. And also your doctor can set up phlebotomists to come to your home, and the phlebotomist will take the blood work so the doctors can see it. So don't be afraid to call and make the appointments with your PCP. Don't suffer in silence. And also for the younger generation, check on your older people, check on them, make sure they're doing okay. You have to be their advocate. You have to be their voice. That's why I established proficient nurse practitioners, because, when people are weak, they can't fight. So I want to fight for them until they get the fight back in them. So that's one of the things I think for right now. And that's a conversation we're going to have to, keep promoting about what's going to happen in 2020 with this election. There has to be an agenda to help improve not only mental health, but the medical health. Because for our middle-aged Americans that have diabetes, obesity, and hypertension that's causing them to die for COVID-19, that's unacceptable. So we need to make sure that that's probably on the agenda moving forward. And then also, we as a people have to take some type of onus as well. I think there's more technology out there to where you can read about, high blood pressure, how to lose weight. But if not, you can always talk to your doctor or go to services like me, like the one I provide.
Awesome. Let's jump back to the mental health side of things for a second. because I believe mental health can have an effect on your physical health, and I'm sure there's obviously research to back that up. So, Venice, let's talk about stress. Let's talk about anxiety, and then Barishef, I want you to chime in with Venice around that because I had a conversation with uh, someone recently who is letting the state of this environment get to them from a mental standpoint, meaning panic attacks, anxiety, things of that nature that maybe weren't even there before, that are now presenting themselves that in which they don't even know what's going on. Someone even before COVID, your stress levels get worked up. You can have a panic attack, and you could think you're dying. You could think you're having a heart attack. You could think you're having a stroke, and even though that's not the case, you constantly put your body under that type of stress. I think it will lead to those things. But let's hear from you, Venice, about any of your experience with those, and then Barashef, if you can chime in once the conversation gets around uh, the repercussions of those things in which it now presents itself into real physical ailments.
Mhm. Yes, the anxiety and the panic attacks. I mean, I think especially for our communities in which before COVID and actually within the past few years, I've seen more people want to reach out and embrace mental health services. However, there are still a lot of people who have been unconsciously taught that we don't talk. It's one of those things where it's just like we don't talk about our stuff, or we keep our family, dynamics or family situations within the family. And now it's gotten to a point where people have no choice but to hopefully seek out services. Or, I've had people call for people. I've had people call and say, my brother is struggling. I don't know what to do. Can I get him on a three-way call, or like whatever is necessary at this point? Because some people still have that mindset of, I don't need to talk to someone. And there are people who are suffering with COVID who are living in their homes, but of course they're stuck in a room, and then their loved ones is down the hall in another room. It's very, very serious. And, I just offer that people, if they are in a place where they are resistant to talking to someone, that they know that this is not the time, because it really is affecting people's, mindset, their day to day.
Mm.
Panic attacks are real, where people, really do go to the emergency room because they feel like they literally cannot breathe. I can offer, you know, as many strategies as possible, but if you're not being proactive about your mental health just as much as you are proactive about your physical health, then it could turn into something that really, really could affect you. Like to the point where you are hospitalized, if anything. I've seen it on both ends. So,
Mm.
what I do offer is, in addition to what Mr. Adams said, as far as like checking on your loved ones and making sure, that they are okay, checking on just those millennials who think that they could take on the world. Because sometimes it's those individuals who are not following up with their mental health and their physical health.
Good point. Barashef, how do you feel that anxiety and stress will affect you in this COVID environment from a long-term perspective?
Well, I think, from a long-term perspective, it's just you have to be preventative. And the things that I do to maintain, and what I stress to my clients, is that these are the things, the healthy measures you have to do as far as exercising, meditation, making sure if there's a job that you don't like, you have to get, move into something else. So when you do get a stressor, it's not as bad. For example, we have, staff. I don't know if you saw the article where, a doctor committed suicide because of the stress that she was taking in New York. And that's a sad case, because you should not go to work feeling depressed, or feeling deprived. We have to look out for each other. We have to not only advocate for our patients, but we have to advocate for our staff to make sure they're not being overworked, tired, and stressed out, because these are the things that happen. I want, to go to work feeling happy, and I want to be able to get to my loved ones and be happy as well. So these are trying times, and it's emotional for, the nursing, the physician staff, because we're supposed to, help people, get them ready, and get them out healthy. But to see a lot of people that have passed on, it can be very depressing. So this is why I think it's, I applaud you for bringing Garner on, because it's not only affecting patients, but it's affecting first responders, essential workers, because to see everybody that has been dying. So,
Mm-hmm.
we have to make sure we talk with each other every day if we can. We have to make time to laugh. If you can go outside, like Venice Garner say, take a walk or watch some type of, comedy movie, do something that's going to shut off all the tragedy you've went through for those 12 hours or 8 hours that you're working. You got to be able to switch it on and off. But
Great.
have to do these things. I think after the pandemic, if you weren't doing something, things that were healthy, you have to start.
Great point. And that's going to segue me into a point about, I'm a firm believer in finding positive out of negative. No matter what the situation, in life, we're going to have roadblocks. In life, we're going to have challenges. But how we respond to those as a community, as humans, that really, it empowers you. So, to your point, I hope everyone on this call in these past 2.5 months have taken up a new hobby, started cook. I know I've cooked more in my life than I ever have. I'm 38 years old. I haven't cooked this much in my whole life, and during this COVID season, um, consistent exercise. I've been taking vitamins daily, which, in the past has been a challenge, but now it's like there's no excuse, So it's like, please take the time for self care, take the time for just enjoying life in a different aspect, because I do believe in the midst of this tragedy, in the midst of this, there are some positives that we're all going to take from it that will empower us moving forward. So we have right now about 10 minutes, and I'm going to give everyone in the participant chat to ask a question. We have one really good question right now I'm going to start with, but I just want to make that offer to everyone that are participants to feel free to ask our experts today any questions around mental health or physical health, any advice, and take advantage of this great opportunity. So the first question comes from Sean Roach. Thank you. And it says, what aspect does a lack of health insurance play in seeking help both for mental health issues and treating COVID-19? And I know both of you are familiar with that. So Venice, you can start first, and then Bear Chef, you can go right after.
I would say at this point, and even 3 to 6 months ago, when it comes to health insurance, if you don't have health insurance, there's always a way. There's always a way. I mean, I know that, now there's stipulations to, for tax purposes if you don't have health insurance, but, you know, um, don't be afraid to ask for help. Again, that's where it goes. Husky is a great insurance. It is something that is provided for everyone who does not have insurance. Again, I think that goes along with the being able to be vulnerable about it, because there's a lot of people walking around without health insurance who haven't, been open enough to talk about it. But once you open yourself up to being vulnerable about what you need, there's always a way, and there's always some sort of resource out there that can help.
Great. Thank you. And Bear
So
Chef?
just a couple resources that I would like to give you. So in Hartford, I don't know about New Haven or the other counties, they do have areas where they've been doing free public testing on 1,000 Asylum Avenue. That's over by St. Francis Hospital. If you have any questions about testing with regards to COVID, they have some phone numbers that I would like to give you. It's the Community COVID-19 Hotline. It's open from 8 a.m. to 8 p.m. The number is 1-888-786-2790. That's once again 1-888-786-2790. And the other numbers: Prevent the Spread colleague hotline, 860-714-9171. Once again, 860-714-9171. Now, if you do get admitted to the hospital and you don't have insurance, the things that what happens, there are case managers on every floor. They will work with you to see if you qualify for Medicaid. And now they can see if you qualify for emergency Medicaid. They'll look at how much money you make, but that should not deter you from coming to the hospital. If you're sick and you need help, you come. And there's other ways to get around your bill to see if you could, you talk to the billing department. You can see if you qualify for, some of them have like Nightingale forgiveness plans, or if you can get on a payment plan or get your bill reduced, because they rather get some money than no money.
Got it. Got it. And if you don't mind, Bear Chef, if you can hit the chat button on the bottom of your Zoom and pop those resource numbers and resources into a message to everyone, that would be awesome, just in case people didn't have a chance to get it.
Okay.
All right. I'm going to ask once again for a raise of hand if anyone has any questions before we begin to wrap up. We have about 5 minutes left. So if you have any questions, or comments, or anything you want to share, I can unmute your phone and you can, share your thoughts or your input. If you have any feedback from these two guests, that would be also appreciated. And Greta offers and says, apologies to healthcare workers for people selfishly trying to guilt them into unsafe situations. Yeah. It's so, there's so much unseen things that the news doesn't show for what our healthcare workers go through on a day-to-day basis. So again, gratitude to them. Latrice says many employers offer EAP. I'm not sure what EAP is. Would anyone care to?
Program.
Yeah, so EAP is an employee assistance program, especially for mental health. If you have, I'm sorry, hold on. Can you put that on mute for a second? If you need counseling, your employer will usually offer 3 mental health counseling through their employee assistance programs, and that someone does not have to pay for. It's free to get like counseling from your employer.
Mm-hmm.
So that's a great resource. My coworker, also Katrina Goins, we've been seeing a lot of anxiety with the Financial Empowerment Center. We offer free financial counseling right now, and she did put our contact information in the chat box if anyone's interested.
That's awesome. Thank you, Latrice, and thanks for coming on camera. So what we're going to do now, we got about 3 minutes left. I'm going to ask my two guests to just give their closing remarks and also tell us about what you have coming up. Tell us about any businesses or ventures or things. I'm sure this audience has appreciated, and I want them to be able to find you on social media and to learn about what you're doing. So Bersha, let's start with you, and then we'll close with Venice.
Well, thank you once again, Jason, for allowing me this platform just to talk to people about the medical aspects of COVID-19. In summary, I just want people to understand that in order for us to get through this, there needs to be a vaccine. There's still no vaccine at this time. So I want to stress that. I want to stress that to Governor Lamont, that, people are over or saying they're over, this crisis or pandemic, but I am not over the fact that we have already lost over 3,000 people in Connecticut and throughout the United States, over 88,000. I'm not over that, and neither should anybody else. I think, moving forward, people have to make plans for the fall. If they still don't have a vaccine or a cure, you have to determine if you're going to put your kids in school or send your kids to daycare or go to work. Those are the decisions you're going to have to make, but I urge you to plan ahead. And lastly, proficient nurse practitioners and Green Logic, these companies, proficient nurse practitioner is a male medical platform to where I want to bring services to their doorstep or via telemedicine to make sure I can advocate for you. The services I provide, if you go to pronp.org, you can see that and you can book appointments. And then Green Logic is supposed to be coming once this pandemic is over. It's sending natural products, teaching us, especially men that have another platform, to educate them on skincare. And I want it to be almost like what Blue Apron was to the food industry. Green Logic wants to do that for the natural product industry, sending you ingredients to your doorstep and having you put it together yourself. So look out for that. That I'm hoping, 2020 to 2021. But you can find me on greenlogicco.com on Facebook as well. Thank you.
Awesome. Thank you. All right.
Yeah, so for me, I have my it's called the Self-Love, Self-Healing Workbook that I've been putting together just based on just some of my sessions that I've had over the past few months. And more so now because of COVID, there are still, obviously there's people who are still resistant to mental health therapy, but this book just allows each individual to sit and work on different activities for themselves, whether that is breaking patterns, whether that is figuring out how to decrease the anxiety that they're dealing with, or even if it's childhood trauma or any kind of trauma. So that book is available on my website for pre-sale. This right now May is Mental Health Awareness Month. So there's just a lot of free workshops and webinars that I'm providing. So, if you go to my website, which is embraceyourdifference.com, or also my Instagram, which is at embrace_your_difference. I'll put it in the chat as well. But most importantly, everyone, I just offer that, through now and hopefully continuously, we realize that our most important project is ourselves. Like, we could be passionate about, so many other things in the world, which is great. It's wonderful to know what you are passionate about, but the greatest project is yourself, making sure that, you provide and look out for your own physical and mental well-being so that you can be the greatest that you can be for yourself to offer what you can to others. So please, take everything that we discussed today and think about what it is that you need for yourself, so that you can continue to be well.
Awesome. Awesome. So, hey, before we wrap up, I want to give a shout out to our Facebook Live audience. I see Melissa Driffin, Margaret White, and Kalisha Fitzpatrick. So with that said, final thanks to my panelists, Barisheth Adams, Denise Garner-Moore, the City of New Haven, and Adrian Jefferson. Thank you so much for allowing us to have this conversation. Hope it's been helpful. We got people trying to pop in. I think there's another meeting about to start shortly. So thank you all, and be blessed and be well, and stay tuned for more from the UPN. See you soon.
Thank you.
Thank you.